this research project was to evaluate the implementation of modernizing the Homes for Special Care program into the Community Homes for Opportunity program. Process and outcome evaluations of the CHO program were conducted in 28 homes. Outcome evaluation assessed the effectiveness of the program by measuring potential changes in the tenant's community integration, housing stability, health status, quality of life, social inclusion, and mental health at 3 different measurement points: baseline, transition, and final implementation. Process evaluation aimed to identify facilitators, benefits, barriers, and challenges throughout the program's implementation. To evaluate how program outcomes were achieved, the researchers conducted focus groups with stakeholders, including tenants, homeowners, home staff, staff from the Ministry of Health, and staff from community agencies. A random sample of 115 tenants were recruited from 28 homes involved in the implementation of the CHO model. Tenants were invited to participate in semi-structured interviews containing both quantitative and qualitative measures. Measures included demographics such as age, sex, and psychiatric history, community integration, quality of life, and health and social service utilization, and housing stability. Interviews were conducted at 3 time points, roughly 4 months apart. Time 1 included pre-implementation or baseline data, Time 2 encompassed the transition period, and finally, Time 3 included post-implementation data. Focus groups were conducted with stakeholders to identify issues, solutions, and recommendations to improve the program. These stakeholders included CHO tenants, homeowners, home staff, staff from community agencies, as well as staff from the Ministry of Health. Descriptive statistics were conducted on demographic variables for participants who completed a baseline interview. The sample was between the ages of 23 and 79 years old, with the average age being 54 years old. 56.9% were males and 42.2% were females. 74% of the participants were single. The majority of participants, 67%, were receiving income from the Ontario Disability Support Program, ODSP, and 41% reported ODSP as their only source of income. 95% of the sample had at least one psychiatric diagnosis, and 35% had more than one diagnosis. The most common diagnosis found among the participants was schizophrenia, 38%, mood disorder, 5%, anxiety disorder, 3%, and substance-related disorder, 1%. The Therapeutic Environment Guideline, or TEG, was an instrument that was used to assess the general environment within the homes. The TEG consists of 13 items that evaluate staff factors, tenant factors, organizational factors, and safety factors as it pertains to the social and physical environment of the home. All items were given a rating from excellent to dissatisfactory, and lower scores indicate better ratings on TEG items. A paired sample sign test was conducted to assess whether scores on the TEG for homes differed between Time 1 and Time 3 interviews. There was a significant improvement in 4 of the items. This includes staff responses to tenant needs, communication in the home, recording of tenant information, and the autonomy of tenants. The quality of life of tenants was measured using Lehman's Quality of Life Interview Brief Version. This instrument measures subjective and objective quality of life in 9 domains. There were significant increases in subjective quality of life in 4 of the domains. These include general life satisfaction, satisfaction with living situation, satisfaction with daily activities, and satisfaction with financial situation. There were significant increases in objective quality of life domains for financial adequacy and amount of money available each month between Time 1 and Time 3. Financial adequacy scores were determined by whether participants reported having enough money each month to cover food, clothing, housing, traveling around the city, and social activities. On the other hand, significant reductions in social contact was found between Time 1 and Time 3. Social contact was determined by frequency of contact with individuals not living in the home. This might be slightly decreased due to new changes and activities that the tenants were involved with inside the home. The Community Integration Questionnaire, or CIQ, is an instrument intended to measure an individual's level of integration in the home and community. The CIQ consists of 15 items that form 3 composite subscales: home integration, social integration, and productivity. An overall CIQ score is obtained by summing the scores on all 3 subscales. A high score indicates greater integration. Results show that there were no statistically significant differences found between Time 1 and Time 3. This indicates that overall community integration, participation in activities in the home, and participation in social activities remained relatively stable across time. The Health Social Justice Service Use Questionnaire assesses issues such as the number of emergency room visits, phone calls to crisis lines, visits by crisis teams, and ambulance trips made in the preceding 6 months. Parent sample t-tests were conducted to assess whether the frequency of service use during the 1 and 6 month interval prior to the first and final interview differed. There were significant increases in the frequency of home visits from a health or social service provider in the past month, between time 1 and time 3. This could be attributed to an increase in CHO worker visits from the implementation of the program. Findings from the focus groups also identified some themes. This included that the implementation process was satisfactory to all the stakeholders, despite the experience of some barriers and challenges. Successful working relationships among all stakeholders were observed. Increased financial support and promoting independence. Increased community integration and social inclusion for the tenants through greater access to community agencies. Tenants gained control and dignity. Perceived challenges due to the cultural shift from the homes from special care culture to the community homes for opportunity culture. Lack of information, lack of communication among all parties, and unclear guidelines and role descriptions for homeowners, staff, and community staff were also reported. Conflict arose from the different perspectives between a nonprofit agency supervising and a for-profit agency providing the housing support. In conclusion, the CHO program evaluation revealed that the tenants' quality of life, community integration, autonomy, and financial adequacy have been remarkably improved. There have been significant improvements in satisfaction with living situation, with daily activities, and with financial situation for the tenants. Focus groups support the need for continued learning opportunities to enhance tenants' budgeting and other life skills. Tenants are able to improve autonomy and independence with appropriate supports through the CHO program.